And also, I would like to take this opportunity to thank members of the public for their effort in the past 3 years. And I would also like to thank friends of the media for your hard work in the past 3 years. At the same time, most importantly, I hope you will all join me in thanking the frontline healthcare workers in both the public and private sectors for their hard work in the past 3 years. And then, of course, there are various other sectors involved in the fight against the epidemic, so we're grateful to them too. And I wish you all to have a peaceful and safe Christmas. During the festive season, please continue to pay attention to personal hygiene. Now, there is a chance of the epidemic easing, but still we need to take steps to protect ourselves and our family members. Now, I will hand over to Dr. Albert Au and then Dr. Gladys Kwan to give you an update first. Thank you. Dr. Lee. Friends of the media, good afternoon. I would like to brief you on the latest situation of COVID-19 in the past week. You can see this chart here. In the past week, on average, there's 15,691 reported cases. Compared to the previous week, that's a slight increase of about 12%. But we can see that since 2 weeks ago, after the number of cases exceeded 14,000 in the past 2 weeks, it's just around 14,000 to 15,000 plus cases. So it seems that the situation is stabilized. For locally acquired cases, they account for the majority of the total number of cases. In the past 7 days, on average, there were 14,833 cases per day. Compared to the previous week, that's a slight rise of about 11.1%. For imported cases, last week, on average, each day we recorded 853 imported cases. Compared to the week before, an increase of 18.18%. For imported cases, they account for all positive account for 5.7% of all positive cases. That's remained as a rather stable level for some time now. For inbound travelers, you can see from this table, there's steady rise. In mid-November, there were about 95,000 inbound travelers. In the latest week, there were close to 120,000 inbound travelers. But among the 120,000 inbound travelers, the percentage of those testing positive remains rather stable at about 4.28%. That's the latest figure. And among the positive cases, 55 of the cases were detected in the PCR positive specimen left at the airport. And then in the past week, there were 222 fatal cases, an increase of 24% compared to the week before. For residential care homes, there is still a high level of cases. In the past week, 390 institutions reported cases involving 1,624 residents and 737 staff members. For residential care homes for persons with disabilities, in the past week, 165 homes reported cases involving 345 residents and 295 staff members. For schools, there's an increase of 50% in cases. That is more or less the same as the percentage of increase for cases in the community. In the past week, there were 11,431 cases involving students and 2,018 cases involving teaching staff. So an increase of 15% and 10% respectively. For Omicron subvariants, you can see that there are new sublineages involving both imported and local cases. For imported cases, we see that the predominant strain is still XBB, and then the next is BQ.1.1. But then for local cases, BQ.1.1 top all cases, and next is XBB. And in this table, you see the distribution of subvariants in local cases. There are new subvariants, BQ.1.1 and XBB. They still account for less than 2% of all cases, local cases. As for the predominant Omicron subvariant, is still BA.5. It accounts for about 60% of the cases. The next is the BA.2 sublineages, about 36% of all cases. As for other indicators, sewage surveillance, we see that it's still at a relatively high level. In the past 2 weeks, the viral the virus viral per capita is about 1.5 to 2 million copies, RNA copies. So it's per liter. So it's still higher than before. But and then for the Hong Kong U is estimate of real-time reproductive number in the past week or so, we see there's a slow decline. Still above 1 at the moment. The latest is 1.18. So it's above 1. But compared to the peak at the beginning of December, when it was close to 1.37, so we're seeing a slight drop. If we look around the world, that's the latest figures announced by the WHO. In the past few weeks, we see that there's a slight increase in the number of cases around the world, but there is not a rapid rise. Now, as winter approaches, the virus is more active. It's expected that the epidemic will become slightly more serious around the world. And then for VOCs, virus of concerns, the most predominant subvariant remains BA.5, accounts for 73.7% of all global cases. The next is BA.2. And then for the new subvariants, there are two that developing rapidly. BQ.1 is now 33.9%, and next one is XBB. It now accounts for 3.19% of all cases. And then we see that we see new strains, emerging. BQ.1.1 and the mainland in North America and Europe, they are becoming more prevalent. And then there are other subvariants predominant in other places. In summary, we can see that for local cases, they remain at a relatively high level, but we're seeing signs of the epidemic stabilizing. There's been no further increase so far. Compared to the week before, there is a slight increase in number of cases by 11.7%. As for cases involving residential care homes, that's still at a high level. For imported cases, only about 4% of inbound travelers tested positive. So again, it's rather stable. And then we see that in other countries, there are new emerging Omicron subvariants, including BQ.1.1 and XBB. And we're seeing such cases in Hong Kong. So that's all by way of report from me. Thank you.
Thank you, Dr. Au. I invite Dr. Gladys Kwan from the Hospital Authority, please. Over the past week, the hospitalization of confirmed cases has been increasing, 3,700 at the beginning of the week. Now, the number has gone over 4,100. The daily admission, 220 earlier to 780 now. The admission from care homes has been increasing. 20% of the confirmed cases are from the care homes for the elderly. Of the hospitalized patients, the critical and serious, the number stands at 260. For those who are using the ventilating machine, the number stands at 580. For non-COVID patients seeking admission, the number has also been increasing. Take yesterday, for instance, well over 5,300 patients turned up at A&E wards for medical attention. 1,600 patients have to be admitted to the medical ward. As to the medical ward beds, the occupancy rate is 113%. We will closely monitor the situation, the involvement of the pandemic, and also the extra need arising from the winter season to make sure that we're going to have sufficient manpower to look after the patients. We have the emergency center that has been activated to monitor the situation. The A&E wards will be stepping up the manpower to make sure that the patients will not be waiting outside the hospitals. For the busy A&Es, we noticed that for non-emergency patients, they will have to wait a pretty long time, and I hope that the patients would be understanding enough, because we have to deal with the critical patients first. For patients who have mild conditions, they should go to the outpatient clinics or the private practitioners for medical attention. We will also be transferring the stable patients to the private practitioners or private hospitals to free up the beds for serious patients. The holidays are coming up. We anticipate that the pressure at public hospitals will be increasing. We will continue to monitor the situation. When necessary, we'll deploy more manpower and beds for the patients. I hand you back to Dr. Lee. Thank you. There you are. You heard that the COVID situation is still on the rise, albeit not as serious as before. It seems that it has hit a plateau. The fatality has been increasing, but for the hospital authority, the hospitalization and the A&E waiting time have also been under some pressure. Given this limited room, we'd like to put Hong Kong back on the path of normality, but we can anticipate, given the Christmas holidays and the New Year holidays, there will be a lot of social activities that will be increasing, and the cold spell is also with us, and this will also lead to more hospitalization among the elderly population. We do have some revision of the social distancing measures. We like to relax the curbs, but we have to be careful in this regard. We have decided on the 22nd of December, there's on Thursday, we'll be relaxing the following social distancing measures. First, we will lift the bars and scheduled premises capacity limit. There will not be any capacity limit. And also for banquets, the headcount limit will also be lifted. Third, in the following places, the RAT requirements will be lifted, and they include bars, pubs, patrons, the nightclub patrons, those attending banquets, and also those joining the local tours. RAT will be lifted. And for the following premises, food and drinks will be allowed, and they include the public entertainment places and the outdoor area of the public places, Mahjong Tin Kao parlor, so food and drinks will be allowed. The outdoor areas of the sporting venue will allow food and drinks. For vaccine pass and the mask mandate will remain. We will be liaising with the CSTB to lift the limitation on the number of people. Now, we like to take a gradual and orderly approach in the relaxation of the social distancing measures. We hope that people will enjoy their normal daily activities, and there will be more people who take part in activities so that we can be back to normal. So much I have to say. I've thrown the floor open for questions. Now it's time for questions. Please identify the organizations you represent. Please limit yourself to 2 questions. Let's take an English question.
Hi. Hello, test. Sorry. I'm from RTHK. Can I first ask about the reasons for the latest relaxations regarding there's no more cap for banquets, and also there'll be no RAT test requirements for certain venues? Why do you do that? At this point, you're saying the COVID situation is still high. The case number is still relatively high. The schools still need to do RAT tests. Why do you relax at this point? You're saying that you expect hospitals to be rather full going forward, especially for the Christmas holidays. Thank you.
Okay. The reasons for relaxations, we know that the holidays and the seasonings is actually coming up, and we the whole government actually looking deeply into where we can actually further relax all the relaxation or all the measures so that we can go back to a normal life. In this regards, even there's a high number of cases of positive cases in the current at the current moment, we still observe the slope of the increase seems to be actually quite settled. We likely actually level off at a high at this end. So we find that this might be able to relax a bit more, like for allowing more people in a banquet, allowing more people in the designated premises, and also take off the RAT test at the moment. For the school children, we understand that they still need to do RAT tests at the moment. We will review these measures timely because at the current moment is already school holidays. So we will discuss with the Education Bureau whether this can be also lifted at the moment.
Sorry, a quick follow-up. Would you give the public a wrong sense that this is the right time to relax, since you're relaxing the measures, but at the same time you're expecting further surge in the winter period and also in the holidays? Are you saying people actually should not gather, or what's the message that you're trying to send? Thank you.
Okay. Actually, Hong Kong has 3 years experience of fighting against COVID. We are now heading to a normal life right now. It's not a question of whether you go back to normal life or not. We are actually heading to a normal life. It depends on how fast we are going forward too, and so that we will seek every opportunity to relax the measures so that we can go back to a normal situation. At the current moment, we do not relax, the mask, which we think that basically mask wearing is cost-effective measures against COVID and also other respiratory diseases. So this is actually something that we will not relax. And also we will not relax the vaccine pass. We actually strongly believe that vaccine is a good protection scheme for all the citizens in Hong Kong. And the current moment is actually quite different from 3 years before. Before, we do not understand what is COVID, what is the situation. But throughout these 3 years, we find out vaccines is effective, drugs are available, and also we are now targeting at high-risk groups instead of the whole populations gear up to fight against the COVID. So that's why, we always talk about the younger age group or the older generation, we need more protection against them. So I hope that you appreciate the whole strategy is actually more risk-based right now.
下一條提問，
Next question, second last row, the lady in black. I'm from TVB. So what are the under what sense are you relaxing the measures? Because we see there are over 10,000 cases each day. Just before the Christmas, you relax the measures, and how many more cases do you expect to go up after the season? And do you have enough resources at the hospital authority to deal with that? And now we also have the winter flu season. You've said that we need to be on high alert. So are you concerned it will add to the risk for the elderly? And do hospitals have enough resources to deal with the new cases? Thank you for the criteria in relaxing the measures. Now we have been striving for return to normalcy, and we are not changing our direction in that respect. It's just a matter of the pace, how fast we're moving towards resuming normal. And we want to, we're always looking out for suitable room for us to relax social distancing measures where we could. Now we see that there is some slowing down of the rising trend. In fact, it's actually reaching a plateau. And then for the majority of the population, the highest risks are still with the old and the young. So if there is a surge in cases, and then we also have the winter flu peak, then what we will do, I will ask the hospital authority colleagues to tell you just now. But for now, we see room for relaxing the measures. But then for the most important measures, we're not relaxing them. For example, the mask mandate, because we believe masks are the most cost-effective way to fight prevent infection and control. And also at high-risk places, we still keep the vaccine pass requirement. So in this respect, we are still keeping firmly to the measures. Now, I will ask Dr. Kwan to explain to you how the hospital authority could deal with a surge in cases after the holidays or to deal with the winter flu peak. Well, we have hospital bed redeployment program. This program was formulated to deal with the epidemic, also to deal with the increase in demand for services because of the winter flu peak. Now we will have temporary beds to take in more patients, and during the winter, there may be the elderly who may have respiratory illnesses and so on. So we need to adjust our services. For example, for non-emergency services, there is a need to make adjustments so we could free up beds and staff resources to deal with the more emergency cases. And then for our outreach teams, they will step up their services to take care of the elderly in residential care homes. Hopefully, with the suitable treatment, they won't need to be hospitalized. And then in terms of manpower, we have the low-cost scheme and other special reward scheme to increase manpower. We will closely monitor our service needs and demand for beds. And in different clusters, we will be redeploying our resources to cope with this challenge. And then we have established practices that have been proven effective. We have designated clinics. There are also oral medication for the epidemic. So we will continue with such measures. And therefore, we will adopt a parallel approach in coping with the epidemic development. Thank you. On the left, the one in white, please. Second last row. I'm from Ta Kung Pao. The chief executive said that over 90% of the social distancing measures have been relaxed. So for the remaining 10%, that is the mask mandate and a vaccine pass requirement, when will they be scrapped? Under what condition will they be scrapped? And then with the winter flu peak arriving, has the government done any assessment that by relaxing these measures that may lead to an increase in flu cases? What about the flu vaccination rate? What is it like compared to, say, the last year? Now, I'll ask Dr. Au to give you information about flu vaccination rate. As for the remaining 10% of measures, say the mask mandate, when are we going to relax it? Well, I said this before. Mask is one of the most cost-effective means to fight the epidemic. Now, in the past 2 years past 2 or 3 years, you see that because people were wearing masks, there were hardly any influenza cases. So masks probably will be the very last of the few steps that will be scrapped as we move towards normality. So we want to use this cost-effective means to help the public fight the epidemic. Now, for the influenza vaccination rate, in October, the Department of Health, together with private practitioners, have launched various subsidy scheme for influenza vaccination. Compared to the same period last year, we've seen an increase in vaccination rate, both among the general public and healthcare workers. I don't have the actual figures at hand, but we are still proceeding with the program. And we can see so far the vaccination rate this year has gone up compared to last year. But of course, the situation this year is a bit different. In other places, for example, in the Northern Hemisphere, or earlier in the Southern Hemisphere when there was winter, the influenza season came earlier than usual. And the rate of increase in cases and also the peak level were higher than that in the previous years. That's because in many other countries around the world, they've relaxed the epidemic control measures. So in the past few years, therefore, there was no surge in influenza cases. But this year, in those places, they have seen a serious situation with influenza cases. So we would like to appeal to the public to take the influenza vaccine. It's available for those aged 6 months or older, especially for the young and the old. If they're not vaccinated, they should get vaccinated as soon as possible. On the right, the one in the blue jersey. I'm from AM730. First, about the gathering ban. You say you're relaxing the cap on number of persons gathering indoor. What about outdoor? because we are seeing, the streets are packed, and then you still have this outdoor gathering ban. So is this ban actually no longer, not effective? And then for others, you suggest them to take PCR tests regularly, and have you instead of doing RAT? So have you considered the feasibility of that suggestion? Now, for gathering bans, we're not relaxing gathering bans. Gathering bans not just about people walking on the street. We're talking about a group of people gathering for certain activities. We have not yet relaxed that ban for the time being. As for regular PCR tests, well, actually, they cannot replace vaccination. PCR tests could only test whether you've been infected with COVID, but then it cannot help you to prevent COVID infection. So those are two separate issues altogether. For persons who are not vaccinated, can they take regular PCR tests instead? So they could still go to high-risk places. But then that could only achieve half of the effect compared to vaccination, because all we know is whether the person is infected as he enters certain premises, but then there's no protection for him. He's not, if he's not protected by vaccine, and when he goes to high risk places, there's still a high risk of him getting infected. So tests and vaccination are two separate issues. They cannot, we cannot replace vaccination with tests. Next, please. Sorry, speaker didn't come through. We will continue to monitor the situation. While Christmas is around the corner, it's also winter, and it's rather cold. If the situation remains stable and when there's room, then for the remaining social distancing measures, I'm sure we will be relaxing them gradually. To the right on the first row, please. I'm from Ming Pao. First question about social distancing measures. Now, this round of relaxation does not cover performing venues. So the capacity limit is still 85%. How come for other venues you're relaxing the capacity limit, but not so for performing venues? Why? Second, another question, for the hospital authority, the bed occupancy rate is some 110%. So do you expect that to go up further? And what were the main reasons contributing to that increase? Other than COVID, are there other reasons? What is your response plan? Do you have the capacity to cope? Third question for the Center for Health Protection. For the vaccine pass, every time when we scan the pass, it is recorded and stored in the eating establishments system, and if necessary, it will be uploaded. Last time, when the Department of Health asked eating establishments to upload the vaccine pass for tracking purpose, when was the last time you did that? Does it mean that this function is no longer being used? So is it the case that the vaccine pass is just to check whether someone has been vaccinated and whether the person could enter a certain premises? Is that all the function it has?
Well, in terms of the premises, the performing venues are also included. I defer to Dr. Kwan first before Dr. Au. Right, about the medicine ward, the admission rate is high, mainly because the number of non-COVID patients is also high. These are senior citizens who are of advanced ages. They're suffering from chronic illnesses, and the cold weather would trigger their illnesses. For the COVID patients, they are pretty serious when they turn up at the hospital, and we do feel the pressure there. But as I said earlier, we do have multi-pronged approach to deal with the issues. I don't propose to repeat them. We do have the remote consultation. We are collaborating with the private hospitals to transfer some of the patients. So there is a turnover of hospital beds to enable us to look after the needy patients. Speaker not coming through. Right about the Leave Home Safe app and the vaccine pass, I guess you're talking about the scanning of the Leave Home Safe app. The government announced last week that upon entry to the premises, there is no need to scan the Leave Home Safe app. But people will have to scan the vaccine pass. They don't necessarily have to use the Leave Home Safe app. They can use the paper-based vaccine pass, and they can also download the vaccine pass from the web. The idea of doing this is to make sure that the under-vaccinated people will not be allowed into the high-risk places, and also the confirmed positive patients. They have the QR code will turn red, so we know that they are the red-coded people, and enforcement action will be taken. In terms of contact tracing, we do not need to have the QR code scanned, and there is no involvement of any contact tracing function. We're not requiring the positive patients to upload the record for us to do the epidemiological investigation. But if people want to record the places they visited, and if they get infected, they would know where they've been. If they are in the habit of scanning the Leave Home Safe app, they can have access to the record. But at the moment, we would not require the positive patients to upload the record for us. And they are not scanning the Leave Home Safe app on a compulsory basis. The lady in white, please. Oriental Daily. Each day we have 30, 40 fatalities and 15,000 positive cases. You are relaxing the COVID curbs. Do you treat the fatalities and the positive cases as no more than numbers? Why do you still insist on having all these curbs? Now, we've asked the Education Bureau. Now, these are AT for schools. It's decision of an Education Bureau. Why is it that the Health Bureau will not take the decision on a scientific basis? Why do you leave it to the Education Bureau to take the decision? All right. Now, we've been doing the press conference for a long time, and we will announce the numbers to many people. Behind the numbers, they represent the numbers, they represent the lives, and each fatality represent a life. We may be announcing 30, 40 fatalities every day. It doesn't mean that the numbers are not important, because every single life is precious. We fully appreciate that in the community out there, except for the patients, people will have to get on with their lives, and to strike a balance between the pandemic and the economic situation and the day-to-day life. We'd like to achieve a proper balance, and that's why we have the measure to relax the COVID curbs. And we've seen a lot of changes in the pandemic, and we have seen a lot of subvariants. It started off as a very serious infection, and by the time we get the Omicron, the infection is milder, so we can adjust the measures. But for the weak patients, COVID can still take their lives, so we have to be cautious, and we have to consider whether the healthcare system will be able to cope if the number is high. Whether it is the serious cases or the deaths, I mean, it would crumble, it would cripple the healthcare system. So we have to look at the numbers. And also for schools, the policy of requiring daily RAT tests, on many occasions, we would discuss with the Bureau, and we do have the healthcare expertise to offer our advice, but we also need the input of the other bureaus, so they would listen to our advice in carrying out the measures. 好的，我哋等你 check it.
MP. So firstly, you mentioned about going back to normal. So why are the remaining measures still in place? And is there a benchmark about when they can be further relaxed? Or is there a roadmap, for example, a number of cases before you further relax these requirements? And then you also mentioned that there's no cap on capacity for all venues. And the red test requirement for banquets and restaurants have been removed. But why is there still a cap on the number of diners? And what's the rationale for keeping these in place? Thank you.
Okay. So the first question is about returning to normal. So returning is the verb, okay? It's not normal. It's not being normal. It's returning to normal. So that's why it's a process. We need to take time to look at the situation, to judge the stress of the medical system, whether we can afford to be normal, to going back to completely normal. So I guess this is a process. And how fast this process can go ahead, that will depend on our medical system, whether it will collapse or not. So it depends on the situation in hospital authority and also the capacity of the medical manpower. So will there be a benchmark or endpoint saying that, okay, now we can lift up everything, so we go back to normal? I guess we understand that it is not a very, it should be a dynamic process. One hand, we look at the situation of the COVID. The other hand, we look at are there actually the medical system can cater for the sick. You know, we still have quite a number of people at a young age or the old age that are not protected by vaccination. In case they need to have medical care, so will our system be able to provide adequate care and medical services to them? I guess this is the key. At the same time, we are handling a flu season right now. So on top of the COVID, there will be flu infecting the patient, especially for those very weak. If they have COVID plus flu, the situation is even worse. So the burden to the medical system is even worse. So that's why with the judge is a dynamic process. So we cannot say at which point we will completely back to normal. So the last one is about the RT. I can't remember. Okay. The 12-bit diner. I think this is a step-by-step point. If we relax the maximum, the total capacity for those premises, the next step, perhaps, if the situation is still under control or in a level form, basically maybe the further step we actually can relax this diner capacity as well. But we have to wait and see.
好，下一個題目，右手邊最後嗰行。
Next, to the right, the last row. Good afternoon. On the mainland, they no longer keep statistics of the mild cases. So will Hong Kong follow suit that says you no longer count mild cases? You only just report the death cases and hospital cases. And can you replace RT with PCR altogether? In some cases, you say you need to keep RT at schools. And even for bars, you could remove the RT requirement. So could you also, in that case, reduce the frequency of RTs for students? Now, on the reporting of mild and serious cases on the mainland, I'll leave that to Dr. Au. Now, on the number of cases each day, you could see from our press release, we actually give a breakdown of cases. So among all the cases, we count the symptomatic and asymptomatic cases separately. And then in the past 2 weeks, for instance, for cases reported, 58% are symptomatic cases, and the remaining cases involve either mild symptoms or no symptoms at all. And then on the mainland and other places, as they will look at how they report cases, and then we'll see how we should report cases in future. And more importantly, we have to look at the number of hospital admissions and death cases. And each day, by press release, we do, the hospital authority does announce such figures, and that will give reflection of the severity of the situation and the burden on the healthcare system. Now, let me first answer the question about students. I didn't say that we have to keep the RAT requirement for students. I said there's room for us to look into situation. Now schools are on holidays now, so we will see whether there's room for improvement. We will make suggestions to the Education Bureau. As for compulsory testing notices, we've said last week that we are reducing the number of such notices, and we are doing that actually gradually. As the epidemic stabilizes further, we'll see whether we must still use PCR tests, or could we opt for RAT, because in some cases we do allow RATs. Next, the one with the scarf. I'm from Hong Kong Economic Times. So you've relaxed the capacity limit for eating establishments, but then there are other major events. For example, Rugby 7 drinking and eating were allowed before the recent product expo, Hong Kong brand expo. You didn't allow drinking and eating. Would you standardize the arrangement? Second question, now for residential care homes, cases have gone up by some 100%. So is the infection situation still under control for residential care homes? And then the sector was reported to have questioned that the whole process takes too long for sending people to occasional care centers, and then others may become infected while waiting for the delivery, for the transportation. So could you respond to that? On residential care homes, I'll ask Dr. Au to take up the question. Well, as I've said earlier, for the number of residential care homes with cases, the level remains high. For example, last week there are 390 residential care homes for the elderly that reported cases involving some 1,600 residents. So in the past 2-3 weeks, in terms of infection among residents, we've seen rather rapid rise. And among these cases, about 46.2%, that's the latest figure, of reinfection. So we believe that for the elderly in residential care homes, if they were infected before, it was probably some 6 months ago, and if they are under-vaccinated, then there's the risk of reinfection is high. In fact, we see half of the cases involved reinfection. So maybe there are many cases involving the residential care homes. Most are mild cases. As for serious cases or death cases, that's relatively low in level, especially compared to the beginning of the year. So we see, therefore, because the vaccination rate in residential care homes has been substantially boosted. In RCHGs, over 90% of residents have had 2 doses, and close to 30% have had 3 doses of vaccine. So maybe there's an increase in cases in residential care homes, but we believe the situation is under control still. Now, in residential care homes, there are many elderly persons, and many have chronic diseases, so it's a high-risk place. And so this is a place that we this is the kind of places we pay special attention to. We keep in close communication with the home operators. There's a platform. Now, every morning, staff have to do RAT every morning, and then positive cases have to be reported at once, and then so that we will then handle the cases at once. For example, we will give medication to the elderly. If necessary, we'll send them to the occasional care centers. Hopefully, we could minimize the chance of an outbreak in a residential care home. So we're keeping close liaison with the Labour and Welfare Bureau. And then last week, for some of quarantine facilities and other sports venue facilities, they've turned the social work department has turned them into occasional care centers. So there will be best to accept residents from residential care homes and prevent an outbreak in these homes. Now, you mentioned the brand product expo. we're talking the social distancing measures we're relaxing involve outdoor areas. Now, we always adopt a risk-based assessment approach in relaxing measures. In places where the risks are low, we will relax the measures first. But then for the high-risk places, we wait till the epidemic is more stable, or if the healthcare system is stable, before we relax the measures there. So for places of public places, especially outdoor public places, because the ventilation is better, so the risks are lower. That's why we're relaxing the measures for these places first. But of course, we'll be relaxing those measures too, but that's when the epidemic is more stable. Last question. I'm from Cable TV. We're seeing close to 10,000 cases, and Dr. Au said that for local cases, they remain at high levels. How come you choose this time in a space is a matter of a week? You've relaxed measures again. The Christmas and winter solstice approaching. Are you worried that by relaxing measures, you're sending out the wrong message to the public that they need not be too concerned about preventing the infection?
錯嘅，而家
Well, as we said, the local caseload stands at 10,000, and this number has been remaining for some time, and it is going sideways. We like to seize this opportunity for people to get on with the normal life and resume the normal activities. In particular, during the festive season, people would like to spend time with their family and their friends. I'd like to make a plea here. You may have fun during the Christmas period. You should not forget about the COVID protocol altogether. You have to wash your hands, keep the mask on. For those who are unvaccinated, should get vaccinated. In particular, for those who are unvaccinated for flu, they should get immunized for flu. This is December, and the winter flu surge is upon us. I urge people to get the flu shot. Thank you all very much.